Living in America should be a ticket to good health. We have the highest gross national product in the world. We spend $2 trillion per year on medical care. A higher percentage of our babies die in their first year of life than in Cuba, Slovenia, Estonia. How can this be? Is this just because 47 million of us have no health insurance? Or is it mostly because of our American diet and personal health behavior?
There are huge inequalities in the society. All this wealth is maldistributed.
Pet food, ice for the pets' water.
And I think that's in part why the US as a whole has relatively poor health amongst the rich countries, and why even the better off people are suffering. And we think that that is not inevitable.
Is inequality making us sick?
Studies that have shown that living in disadvantaged neighborhoods is related to an increased risk. There's about 50 to 80% increase in risk of developing heart disease. And this has been replicated in other studies.
Imagine if you needed urgent medical care. It might be a frightening experience. Now imagine what it would be like if you didn't speak the language.
If you can't communicate with your provider and you don't understand what's going on with you, how can you take care of yourself?
Taking care of yourself is becoming a little easier thanks to one Boston hospital.
What we're trying to do with El Planeta is to quarterly get information out about the issue of disparities and improving your health and health care.
The center is also trying to improve health care by launching bilingual care programs outside Boston.
We want to make sure that patients have access to materials that are in their own language. So if for Latinos, they need to have some things in Spanish.
Where you stand on the economic ladder is a good predictor of health.
The higher the grade, the better the health. The lower the grade, the higher the mortality rate, and the shorter the life expectancy. In this remarkably graded phenomenon. So if you were second from the top, you had worse health than if you were at the top. If you were third from the top, you had worse health than if you were second from the top, all the way from top to bottom.
Stauffer and other wealthy Americans have more options, resources, and power to control their lives, all contributing to better health.
People who are disempowered, people who don't have autonomy, people who have little control over their lives, are at increased risk of heart disease, increased risk of mental illness, in the Whitehall studies, increased risk of absence from work, and increased risk of decrements in functioning.
I'm Richard Kirsch. I'm the National Campaign Manager for Healthcare for America Now. We've built this campaign to be sure that we can help President-elect Obama deliver on that promise of good, affordable health coverage everywhere in the country. When President-elect Obama introduced Tom Daschle, he said, in 2009, we're going to have affordable, accessible health coverage for every American. And that was like music to my ears, and I'm sure your ears too.